watching you guys in your labs, you are once again getting into the habit of not paying attention to your patient and instead paying attention to whatever instructor happens to be there. Your communication is primarily with a third-party observer and not with your patient and team. So apparently I need to do something different and more drastic to get you guys to stop talking to somebody who isn't actually ever going to be there, right? It is, I understand that I get picky about some of these things, but it's an overall mindset. And an overall mindset can change a whole lot in the end. Let me take it completely out of context for just a minute. Just totally out of context. Just related to how little things actually matter. There's a study that was done at the University of Oregon by a friend of mine by the name of Santiago Lorenzo. And he is a doctor down in Florida right now. But he was doing physiology research at U of O in the environmental physiology lab. And one of the research items that he ran was a research on professional cyclists, racers. And the whole goal of his particular study was to determine whether or not acclimation and training in the heat was a benefit to cyclists. So he stuck them in an environmental chamber and made them train and cycle in a hot environment for a period of time. I can't remember the length of time that he was doing. I think it was a 2-week trial or something to that effect. And they started with a time trial before they did the training protocol, and they ended with the trial, with a time trial at the end of the protocol. And during the protocol, while they were biking, they had to do things like have rectal temperatures being taken in real time all the time, so they were biking with a probe, amongst other things that they were doing the entire time. It was quite abusive, frankly.
Cody wants to sign up.
That sounds like a great
Great time.
Rectal probe, and he's like,
Let's go for a ride.
And in the end, I'm fast forwarding a whole bunch. And in the end, they found that across the board, it increased their time trials by about 1%. Big deal? No big deal.
Could be a big deal.
But that year, the year that he did that experiment, that year, if the 25th place Tour de France cyclist had increased his time trial by that margin, he would have not only taken first place that year, but he would have broken every world record that's been done. Just by that small, itsy bitsy little margin. No big deal. It was a huge landmark study, and it's been referenced amazingly in professional cycling ever since.
What year was that?
Just a few years ago. 2007-ish, 8-ish. I'll be happy. I'll have a
10 years.
copy of it. I'll be happy to give you that information.
Well, I'm just thinking, never mind.
Curious if it was the heat or the probe that made it.
We have other evidence from other
Oh.
studies that show us the heat. Not the probe.
valid question.
Why I throw that dumb little thing out there is that I'm talking to you guys about mindset. It's such a small little thing. But you have to remember that in these small little things, you're gonna be in a total chaotic situation. Your scenes are gonna be chaotic. Your brain is gonna pull from what your brain has been trained to do. That's what it's gonna pull from. Now, I'm not gonna sit there and suggest that when you're on scene, in the chaotic situation, you're gonna turn and look for someone to tell you what the pulse is. That's not what I'm saying. But I am gonna say that in that scene, because you didn't go through a certain training process in your mind and in your brain, you will be confused, and you'll take longer to make the right decisions, and you'll be more apt to make the wrong decisions or make mistakes. It's a mindset, and it's a mindset now. Does that make sense? Check the damn pulse on your patient and state what the pulse is. If it needs to be different, then your instructor can change it. Good?
So with the mannequins, is what we were using yesterday,
Mhm.
do we take it and then,
Do you know what age your patient is?
no, not usually for that.
You don't know what age your patient is?
Yeah.
You're looking at the mannequin, you can't tell if
10-year-old
it's...
male.
20 to 30, I don't know.
Great! What's the pulse rate of a 20 to 30-year-old?
So I could just say, oh, I have 60,
You bet.
okay.
Absolutely.
Okay.
Sure. Take a blood pressure. Come up with an average blood pressure. Just talk to your team over what it is, right? CBGs were taken. Things like this, and actually, Allie took a CBG in there on your scenario, yes? And you did it the right way. You walked in, you said, I've got a CBG of 100. And Raleigh said, CBG is 110. It was the perfect interaction in that moment in time. And it's the only time I saw it the entire day. Of the ones that I saw, I'm not saying no one else did it, I'm just saying, of the ones that I witnessed, that was the first time I saw it that day. Whatever day it was. Was that yesterday? Okay, yesterday. Right? It's a mindset. I want you talking to your patients, and I want you talking to your team. And I want you to disregard that anyone is watching you. I want you to get away from it, right? Stop being distracted by everything else around you. It's all a mindset. I'm going to talk more about mindset today, which is going to annoy some people, but that's okay. It's all about a mindset, right? Okay. Annalise and Brooke and I had a conversation. I'm going to share our conversation. It's a good conversation. They asked me some questions. They asked me some questions about EKG. We had a great time. We were talking. I had a great time because I even geek about this stuff. We're talking about EKG. But a comment was made. Related to Access. Another medic from another agency someplace happened to mention to somebody that I never use Access. It's ridiculous. It's the stupidest thing that a paramedic could learn. I'm paraphrasing. But basically, that's what was said, right? From the standpoint of, are you, as a paramedic, going to be able to be a good paramedic without having to be able to calculate the axis of the heart? Yes, you can. You can. You can. There's never been a time, I don't have a single patient that I've ever had where me knowing or not knowing the axis was the difference between whether or not I treated them properly or not. Right? That's just not been the case. But understanding axis and understanding how it fits within the context of what's going on with your patient is one piece of a multi-layered puzzle that you're trying to figure out in your patients. And you're trying to increase your speed and your understanding of what's going wrong with a patient and coming up with the right decisions faster in any given context. And when you pick up a 12 lead and that piece of information pops into your head because you know axis and you look at it and you immediately see that there's an axial problem going on, that already starts to focus your brain on the problems at hand that could cause that, and it already goes through a process of eliminating things that are not likely to be a problem because of where it's at, even without you knowing it. You've already started your differential diagnosis off of just a glance at something because your brain has been trained to recognize this over that. It's a mindset there as well. It doesn't mean that if you don't know it, that in the end you're not going to take care of them. It's one more small tool, one more piece of you being able to be better at what your job is. Better at being able to take care of them, right? If you've got a diabetic patient who's hypoglycemic, you've done the right thing if you show up and they've got a CBG of, 38, and you've provided them glucose, you've provided them D50, you've brought them back up, and you're done. You've done your job. You've taken them out of their emergent situation. You've brought them back from their AMS that they had, right? You're in a good situation there, right? But you haven't done the right thing completely, have you? You all know this now. Something as simple as a hypoglycemic patient. Because what haven't you done yet?
Transport decision?
You haven't made them a sandwich. And Noah, why would you need to make them a sandwich?
And they're just gonna crash again.
Because you know one step further about what straight glucose does in the bloodstream. You know full well that straight glucose in the bloodstream absolutely is going to engage their brain properly. But you also know, because you took AMP, even if we haven't talked about it in here yet, you also know it's going to spike their insulin, it's going to store the rest of the glucose, and it's going to force them to be in a hypoglycemic stage beyond what they were the first time, if you didn't get them any complex carbohydrates to follow up. Which means you're going to be back on that patient again in a couple of hours, only they're going to be worse than they were the first time. Right? It's about a larger picture. It's about mindsets, and it's about gathering all of the right information for you to make the best decisions that you possibly can. And you're not going to have simple patients all the time. You're simply not going to have simple patients. You're going to have complex patients. Good? Those are things you have to keep in mind. So I would like to see changes in the way you approach certain things. And one of them in the scenarios, I want to see a change in the way you approach your patients and your team. Just forget about Chris being there. Forget about Doug being there. Forget about when I walk in the room. Forget about anyone else being in the room. Zone yourself out to your patient and your team, and nothing else matters. You're going to have an audience for the rest of your life. Everywhere you go, you're going to have an audience, and it can't change your interaction with the patient, and it can't change the interaction for the team. What are you going to do the first time you have a pediatric patient and a pediatrician's on scene?
Do you want this one, or do you want me to take this one?
Right? How are you gonna treat your patient differently if a physician's on scene, a trauma surgeon is on scene when you're there with a rollover car accident? Is that gonna change what you're gonna have to do to that patient?
It should.
What can that trauma surgeon do?
Nothing that you
And
can.
he
Not
might,
even what you can.
Sorry, not what you.
he doesn't know the tools and the things you need to go through to get your job
Absolutely
done.
not. Right? Get past thinking of being watched, because you are going to be watched every moment in EMS. Start focusing on your patients and your team, and make it work with your patients and your team, and be annoyed at everything else around you. Forget about everything else around you having some sort of interaction with you. Good?
I think it becomes easier when we have the ability of using our team.
Yeah, I agree.
I like the idea of not having the ability of using the hive mind, because it makes you think about everything on your own. But once you start having the ability of using your team, I think yesterday our team worked exceptionally well together, and I know we asked a few questions towards the Walker, but it was seamless and it just flowed a lot easier because we were able to hive mind it, so we didn't have to ask.
Or not even hive mind, but just we knew it needed to be done.
Yeah.
There was
It was
questions.
easier just to say, okay, literally throwing your back and forth between each other, because we would be that like we just did. So it's easier to do it that way.
Sure. Do it anyway, even when it's
Oh, no.
not easy.
I mean, our team sucks together. Never mind.
Yes, we suck.
Good? Questions on that? Okay, I want to talk a little bit about the projects that you guys are going to be